This is why lab tests work. Have you ever thought about that? Like, why is it that you can draw some blood from somebody's arm and then make assumptions about how many electrolytes they have in their entire body? It's because those electrolytes, they spread out evenly throughout the blood. Blood is mostly water. If you don't know what blood is, think about this. I talked to a tutoring student about this the other day, one of my one-on-one tutoring students, because I realized there's a lot of things in nursing school where before nursing school, especially if you don't have any healthcare experience, we use vocabulary one way, a kind of a casual way. But then when you get to nursing school, sometimes vocabulary is um, it's more formalized, like it has a very specific meaning. And so when we talk about blood, casually, we might mean like when you cut yourself and you bleed, or you might mean like red blood cells specifically. But when we talk about blood in the medical context, it's very specific. It's not red blood cells by themselves. Red blood cells are only one component of blood. There's also white blood cells. There's plasma, right? Plasma is actually what makes up the majority of blood, and plasma is mostly water. So water makes up the majority of plasma. So most of our blood, what we think of as blood, is actually water. And that's because water is the universal solvent. It dissolves almost anything. Life on this planet could not exist without water. It's amazing. So we have the things that are dissolved in the water. If you're studying fluids and electrolytes, let's talk about electrolytes. Sodium is the most common electrolyte that is dissolved in the blood. And if you just take a sample of blood, because of diffusion, because sodium wants to spread out as evenly as possible throughout the blood, then when you take a small sample of blood, you can measure how much sodium is in that small amount of blood. You can take a ratio, and that tells you approximately how much sodium you have in the entire body. So you can know if a person is in homeostasis related to their sodium levels based on taking a small sample of blood. Isn't that amazing? Like, right? Like 100